10:31 now, and there are more than 100,000 pediatric cases of scoliosis reported in the U.S. annually. Early detection has a big impact in the outcome here and prevents the need for surgery in some cases. So happening today, Akron Children's is launching a new initiative that aims to spot scoliosis early on. And it's happening at Edgewater Beach, and it's a gorgeous day, like we've been telling you. So, Elizabeth, what a great day to come to the beach, right?
It's a beautiful day to come to the beach, and it's an important day to put on sunscreen because it is definitely sunny out here, and it is a great time to check your kids for scoliosis. I'm joined this morning with Jessica from Akron Children's. Jessica, tell me a little bit about what's the connection between the sunscreen and the checking the spine.
Yeah, so it's a good opportunity to really have clear visualization of your child's body, and that way you can see if there are any subtle findings of scoliosis.
Now we have two models here for us. This is Charlotte and Ellie. Is that right? Okay, perfect. And they're going to show you a little bit about what these checks look like. Will you walk me through?
Absolutely, yeah. So are you okay if you're going to be my model? So the first thing you want to make sure is that your child is standing up nice and tall and straight with their shoulders back, and you're going to look and make sure that their shoulders are level on both sides. When you're looking at them from behind, you're going to look at their shoulder blades and see if one is higher or lower than the other, or one sticks out a little bit more than the other. You're also going to look at their waistline to see if they have any asymmetry where it's curvier on one side than the other, and their hip heights should be level as well. Then when you have them bend forward and touch their toes, you're going to take a peek and see if one side of their rib cage is higher than the other, or one side of their lower back is higher than the other. And the final thing is some kids with scoliosis have what we call a trunk shift, which is where they look almost like they're leaning to the side. And so if you see any of those findings, we'd recommend that you take them to their primary care provider or an orthopedic specialist for further evaluation.
We were talking, there are a small percentage of cases that require surgery, but early intervention is the secret here. Why is that?
So if we catch a curve when it's small enough and the child is still growing, for kids who do need treatment, we can implement a brace, and the brace can slow the progression of scoliosis to hopefully prevent the need for surgery. If a child presents too late when they're done growing and their curve is large enough, unfortunately, that's typically our recommended treatment.
So you guys are out here until noon today. People can still pop over here and give you a visit. What are you guys offering? You guys have some free swag you're handing out as well.
Yes, so we have beach towels, and then we have bottles of sunscreen. And the bottles of sunscreen actually have the signs of scoliosis on them so that you can reference the bottle when you're assessing your child so you don't have to remember it.
And you, as well as another nurse practitioner, are here as well, and they are doing free checks, which you can't beat free.
Right, exactly. Yeah, Geraldine Barnett is here with me today. She's a nurse practitioner at Akron Children's with me, and we're here until noon, and we're happy to see anyone and everyone that wants to come in for a check.
Thank you so much for joining us this morning. And this is something you definitely want to check out. As we mentioned several times, it is going on until noon here at Edgewater, and it's definitely a great opportunity to get just someone to look at your kid's spine for a second and see if maybe it's a conversation that you need to have with your pediatrician. If you can't make it out here today, it is also a great question to ask your pediatrician during your next visit. So don't forget to do that if they're not checking them regularly.
So important, Elizabeth. Thank you for that information. I know you're a mom yourself, so you said, this is something you're going to think about too. So appreciate you as always. Thanks, Elizabeth.